tuberculosis, or TB, is a potentially serious bacterial infection that mainly affects the lungs. TB spreads through droplets in the air from coughs and sneezes. Many strains of TB are drug-resistant. There are two types of TB, latent and active. Latent TB is a condition in which you have a TB infection, but the bacteria remains in your body in an inactive state. Latent TB isn't contagious, but it can turn into active TB. Treatment is very important with latent TB to control the spread of the virus. Active TB is the condition that makes you sick and can spread to others. Symptoms of TB include coughing that lasts 3 or more weeks, coughing up blood, chest pain or pain with breathing and coughing, unintentional weight loss, fever, fatigue, and more. According to the Mayo Clinic, to treat tuberculosis, you must take antibiotics for at least 6 to 9 months. The exact drugs and length of treatment depend on your age, overall health, possible drug resistance, the form of TB, either latent or active, and the infection's location in the body.
System would have contained the infection and prevented us from suffering the disease. It is when our immune system is weakened due to any reason or is overwhelmed by the infection or any other cause that we suffer the disease. This is called reactivation, and this is when the symptoms of TB appear. The bacteria can also travel from the foci of infection in the lungs to other sites like the lymph nodes, spine, etc., leading to secondary infection. For example, TB of the skin could present with a non-healing ulcer. TB of the spine could present with backache, stiffness, or even swelling in the back or groin. TB of the intestines could present with abdominal distension and absolute constipation. Even a non-healing anal fistula could be due to TB. TB of the lymph nodes can present swellings at multiple sites of the body. TB of the covering of the brain and spinal cord can cause TB meningitis, especially in children. By maintaining good health and immunity, you can prevent getting infected with tuberculosis. Nutritious food, adequate sleep, exercise, and leading a life with minimal stress go a long way in helping our immunity fight any infection well, including TB. Work on improving your immunity by including diet rich in antioxidants. Have at least 4 to 5 servings of fresh vegetables and fruits every day. If you cannot have it due to certain practical constraints, make sure you take your daily dose of antioxidants or multivitamins after consulting your doctor. Antioxidants help fight free radicals produced in the body due to any kind of disease or stress and help in cell repair.
Eating antioxidant-rich foods help to combat TB since they fight against bacteria. Eat a variety of fruits like apples, pears, oranges, watermelons, peaches, plums, strawberries, blueberries, papaya, pineapple, and vegetables like carrots, beetroots, tomatoes, green leafy vegetables, broccoli, bell peppers, and asparagus. Low-fat protein options like eggs, lean chicken, fish, milk, yogurt, cottage cheese, sprouts, legumes, and pulses are also advised as they aid in recovery of infected cells. Vitamin B complex counteracts the negative side effects of common drugs used for treating TB and hence should be a part of diet. Such foods include whole grains like oats, brown rice, millets, and quinoa. Also eat nuts and seeds like almonds, walnuts, pumpkin seeds, and sunflower seeds, as they have vitamin E, which helps fight infections.
I'm Tanya Eberhardt, and this is Yoga Exercises for Lungs. Yoga exercises for lungs will help you increase your breathing capacity. Since you cannot live without breath, and your lungs are one of the organs involved in respiration, they become one of the most important tissues to exercise. The following pranayama exercises will help you put your lungs to work and improve your breathing capacity. Come to a comfortable seated position. That might be Indian cross, on your knees, or with your shins crossed. Take your right thumb and place it on your right nostril. You're going to inhale through your left nostril. You're going to take your index and middle finger and place it on your left nostril and exhale through your right nostril. Inhale through your right nostril. And exhale through your left. Inhale through the left. And exhale through the right. Do that for about 30 seconds and increase your time until you get to 60 seconds.